Welcome, curious minds, to another deep dive. Today, we're taking a fascinating plunge into a part of a horse you might not think about much, but it's absolutely crucial for their well-being, the intricate world of equine eyelids. You've sent us some really detailed sources. I mean, everything from specialist study guides to practical clinical excerpts. It gives us this comprehensive look into understanding, diagnosing, and treating problems
hmm
in this delicate area. Our mission today is, well, to cut through the medical jargon, pull out the most important nuggets of knowledge, and give you a clear perspective on why these seemingly simple structures are so vital and what happens when things go wrong. So, for someone trying to grasp this complex area quickly but thoroughly, what does this all mean?
Yeah, it's pretty striking when you think about it, just how much the health of the entire eye really hinges on the eyelids working properly. We're going to unpack the remarkable anatomy, explore the systematic way specialists approach diagnosing problems. It's almost like detective work.
Yeah.
And then dive into the most common and frankly challenging conditions. It's a great example, really, of how a small, often overlooked part of the body plays this huge role in overall well-being.
That idea of small parts, huge roles, yeah, that really hits home. So, to appreciate why they're so critical, let's start with the basics. What are we even talking about when we say eyelids in a horse?
Okay, foundationally, we're looking at these mobile folds, skin, muscle, and that inner lining, the conjunctiva, upper and lower eyelids. But they aren't just passive flaps, right? They're dynamic.
Mm.
You've got key muscles. The levator palpebrae superioris that one lifts the upper eyelid, it's controlled by cranial nerve 3, and then the orbicularis oculi encircling the eyelids. Crucial for blinking shut, that's cranial nerve 7.
Okay, muscles for movement. But you mentioned other bits too.
Absolutely. The unsung heroes, maybe. The meibomian glands. They're basically modified oil glands sitting right in the eyelid structure, in the tarsal plate. They produce the oily part of the tear film, super important for stopping tears evaporating too quickly. Their little ducts open right onto the eyelid margin. And, of course, eyelashes, mostly on the top lid.
And then there's that extra one, the one that's kind of unique to horses.
Indeed, the third eyelid, or the nictitating membrane. It sits there in the inner corner, the medial canthus. It's made of cartilage, lymphoid tissue for immune stuff, and its own little tear gland. This thing, it plays a vital, multifaceted role, spreading tears, protecting the eyeball, even immune surveillance. It does a lot.
So way more than just blinking then. What are the core jobs they do?
Exactly. Blinking is part of it, but the functions are bigger. 1, protection. A physical shield against getting hit, dust, flies, you name it. Environmental irritants, too. 2, tear film distribution. Blinking is how that tear film gets spread evenly across the cornea, keeping it moist. Essential. And 3, tear drainage. They actually help channel the tears towards the little drain holes, the lacrimal puncta, and down into the nose via the nasolacrimal duct.
Wow, okay. That's a lot going on in such a small space. So given how complex that is, how do vets even begin to figure out what's wrong? It sounds like you really do need to be a detective.
That raises a really important point, differentiating issues. And yeah, it does feel like detective work sometimes. A systematic approach is absolutely crucial. The number one rule, always do a complete ophthalmic exam when you're looking at eyelids because, other eye problems or even systemic diseases might be hiding in plain sight or causing the eyelid issue.
Right. Look at the whole picture. So where does the detective work actually start? What's clue number one?
It starts with a thorough history. You need to know the story. When did it start? How long? Has it gotten worse? Any previous eye problems or injuries? Any signs of the horse being sick otherwise, like a fever? Nasal discharge? Even the breed can give you clues sometimes, certain predispositions.
Okay.
And of course, did they try any treatments already? Did they work? All vital information.
Got it. So you've got the backstory. Then it's time for the hands-on part, the examination.
Precisely. The ophthalmic examination, it's comprehensive. You start with general observation. Look at both eyes. Are they symmetrical? Is there swelling? Discharge? Is the horse squinting that's blepharospasm or sensitive to light? Any obvious lesions? Then palpation, gently feeling around the eye socket. Is it swollen, painful? Any crackling, which could be air under the skin or any masses. Then you get close-up. Detailed inspection. Look right at the eyelid margins. Are they rolling in? That's entropion or ectropion. Check the lashes, the conjunctiva. Is it red, swollen? And that third eyelid, how's it sitting?
And you mentioned a tool that's absolutely essential.
Yes. The fluorescein stain. Cannot stress this enough. It's a simple dye test, but it's absolutely essential. It immediately shows you if there's any damage to the cornea, like an ulcer or a cut. Things that can easily be hidden by swelling or squinting.
So you never skip that.
You never skip it, no excuses. Then there are other checks. Maybe a Schirmer tear test to check tear production, though that's less common for just acute eyelid stuff. You check vision pupillary light reflexes, menace response, measure the intraocular pressure, the eye pressure to rule out things like glaucoma or uveitis, and like I said, always follow up with a complete exam of the whole eye.
And sometimes, even with all that, you need more clues. You mentioned ancillary diagnostics.
Yeah, exactly. If we're trying to connect this to the bigger picture, sometimes you need more specific info, like if you suspect an infection or inflammation or especially a tumor. So culture and sensitivity testing for infected wounds or really bad conjunctivitis helps pick the right antibiotic. Biopsy and histopathology. This is crucial for any lump or bump on the eyelid. Is it cancer? Is it just inflammation? They can look really similar sometimes. You need the lab to tell you.
Okay, biopsy is key for masses.
Absolutely.
Mm.
And then imaging. X-rays, ultrasound, maybe even CT or MRI scans. These can show you if something's going on deeper in the eye socket, if there's a hidden foreign object, or how far a tumor has spread. The goal is just to build that complete picture because, as the sources point out, inflammation and neoplasia tumors can look incredibly alike when you first see them.
Okay, that makes sense. Build the whole case file. Now that we know how vets diagnose these things, let's dig into some of the specific problems. Where's a good place to start?
Let's kick off with eyelid trauma and lacerations. They're common, often happen suddenly, so they're emergencies. Diagnosis is, well, you see the cut, but you have to explore it carefully. How deep is it? Does it involve the eyelid margin, that edge? Does it involve the tear drainage system? And the absolute top priority, every single time, rule out globe rupture. Make sure the eyeball itself isn't damaged.
Right, the eye itself first, and the outlook, prognosis.
It's usually excellent if you get it repaired quickly and correctly. Eyelid tissue heals incredibly well, but the prognosis gets worse if there's a big delay or if a lot of tissue is missing, especially if it involves that eyelid margin or the tear ducts. That can cause long-term problems.
Okay, so quick action is key. What does treatment involve?
It's a multi-step process, really. First, emergency management. Again, that fluorescein stain, essential. Pain control, usually NSAIDs. Topical antibiotics like a triple antibiotic ointment. And maybe systemic antibiotics, too, if the wound is deep or dirty. And critically important, tetanus protection, always.
Don't forget the tetanus shot.
Got it.
Then surgery.
Yes, surgical repair. Ideally within 24 hours. It involves careful debridement, cleaning it up, removing only tissue that's clearly dead. But you want to save as much as possible because, like I said, eyelids have amazing blood supply and they heal well. Then precise layered closure. You stitch the conjunctiva, then the muscle, then the skin in layers. And for the eyelid margin itself, this is crucial. You need perfect alignment to stop a notch forming later, which can irritate the eye. Often use a special suture pattern like a figure of 8 or just simple interrupted stitches to line up those little meibomian gland openings perfectly.
Wow, that's intricate.
It is. And if the tear ducts, the puncta or canaliculi, are damaged, you have to stent them open during healing. Finally, post-op care. Continued antibiotics, NSAIDs for pain and inflammation, warm compresses can help, and protection of fly mask or maybe an eye cup. Sutures usually come out in 10 to 14 days, though some sources say you can leave them longer, maybe 2 to 4 weeks, because the eyelid moves so much.
That's incredibly detailed for just fixing a cut. It really highlights the precision needed. What about conditions where the eyelid structure itself is the problem, not an injury?
Right. That brings us to entropion. That's where the eyelid margin rolls inward. So the eyelashes and hair rub directly on the cornea and conjunctiva. That rubbing is called trichiasis, and it's really irritating, potentially damaging.
Ouch. What causes that?
It could be congenital inherited. You see it in certain breeds like quarter horses, Appaloosas, drafts. Often shows up in foals just days or weeks after birth. Or it can be acquired, sometimes called spastic entropion. This happens secondary to something else, like severe eye pain causing the horse to squint hard, rolling the lid in. Or even conditions like dehydration or being really underweight, which makes the eye sink back a bit. That's an ophthalmos, and the lid can roll in.
So how do you fix it?
Well, for foals, or those temporary spastic cases, you can try temporary fixes first. Lubricants, maybe antibiotics if there's irritation. And then strategically placing sutures or even skin staples to just pull the eyelid outward for a week or two. Sometimes injections of things like penicillin or hyaluronic acid can create a little bleb to push the lid out. But for permanent correction, you usually need surgery. A common one is the Haupt-Celsus procedure. Basically, you remove a crescent-shaped piece of skin and muscle below the margin to tighten it and roll it back out.
Okay. And the opposite problem, eyelid rolling outwards.
That would be ectropion. The margin rolls out, everts. This exposes the conjunctiva. makes the eye dry, prone to irritation, and stops the tears spreading properly.
What causes that? Is it common?
Congenital born with it ectropion is actually pretty rare in horses. It's more often acquired, maybe from facial nerve paralysis, trauma, scarring from previous surgery or bad injury, or, again, severe emaciation.
And treatment?
Medically, you use lots of topical lubricants to protect the cornea from drying out, but often surgery is needed to fix it. Things like a wedge resection or a V to Y plasty to shorten and tighten the lid. The prognosis, though, it can be guarded. Depends heavily on the underlying cause, you know. If it's nerve damage, that might be permanent.
Right. Depends on the root cause. What about just plain old swollen eyelids?
Eyelid swelling or edema, also called blepharodema, very common. Often it's just simple trauma, a knock, or allergies. Insect bites are a huge one, especially fly bites. Those are usually acute, sudden onset, often both eyes, and really itchy. The horse will be rubbing its face.
Okay, allergies or bumps? Anything more serious?
Yes, a deep infection, like orbital cellulitis infection in the eye socket, can cause really bad swelling. Usually just one eye, it's painful, warm to the touch, and the eye might even bulge forward a bit. That's exophthalmos. It can also just be secondary to conjunctivitis, or, less commonly, it might be a sign of systemic edema fluid buildup in the body, or even hiding an underlying tumor.
So swelling isn't always simple. How's it treated?
Always treat the underlying cause. Cold compresses for that acute bump, systemic corticosteroids or antihistamines for allergies, aggressive antibiotics, maybe systemic and topical, for something like orbital cellulitis. You have to target the root of the problem.
Okay, now this is where it gets really interesting for me. Tumors. What are the big players when it comes to eyelid tumors in horses?
Yeah, this is a really crucial area, eyelid neoplasia. Tumors. They can be challenging. The most common one by far is squamous cell carcinoma, SCC. It's locally invasive, meaning it grows into the surrounding tissue. It can metastasize, spread elsewhere, though that's maybe less common from eyelids initially. And it's strongly linked to UV light exposure, sunlight.
So like skin cancer in people.
Exactly. So horses with white or pink skin around their eyes, Appaloosas, paints, Belgians, sometimes they're predisposed, can look like a little nodule or ulcerated plaque or just a fleshy mass.
Okay, SCC is number one. What's next?
Second most common would be sarcoids. Now, these are technically benign, meaning they don't spread systemically like cancer usually does.
Yeah.
But they are locally aggressive, they invade tissue right where they are, and they are notorious for coming back after treatment. Highly recurrent.
Why do they happen?
They're caused by bovine papillomavirus. Somehow horses get infected. They present in lots of different forms, flat ones, warty ones, lumpy ones, fleshy ones. Some are really aggressive. They're a real headache to treat.
Wow. Aggressive but benign. Tricky. Any others?
Yes, melanoma. Particularly common in gray horses. Usually they show up as dark, firm nodules. They can be benign, just sit there for years, or they can become malignant and spread.
So SCC, sarcoids, melanoma, how do you know which is which?
Biopsy and histopathology. Absolutely essential. You have to take a sample and send it to the lab for a definitive diagnosis. You can't just guess based on how it looks.
Right. And treatment. Must vary a lot.
Hugely dependent on the tumor type, the size, where exactly it is on the lid. Options include surgical excision cutting it out. For SCC, you need wide margins, take plenty of healthy tissue around it, cryotherapy freezing it, CO2 laser ablation, radiation therapy like using iridium-192 implants, and chemotherapy, sometimes topical creams like 5-fluorouracil for SCC, or injections like cisplatin for SCC, or Aldara cream for sarcoids, or even BCG injections for sarcoids. Immunotherapy is also used for sarcoids. Lots of options.
Sounds complex. What's the outlook?
Generally good for small, early SCCs if you get clean, wide surgical margins, but it's more guarded to poor if they're really extensive or keep coming back. Sarcoids. Prognosis is always a bit guarded because of that high recurrence rate. Depends on the type and location. Melanomas in gray horses, usually pretty good unless they start behaving aggressively.
Okay, a lot to consider with tumors. And finally, what about issues with that third eyelid, the nictitating membrane?
Right, third eyelid ailments. They're less common than problems with the main lids, but still important. Prolapse of the gland of the third eyelid, sometimes called cherry eye in dogs, is actually pretty rare in horses. If it happens and causes irritation, it's surgically corrected. Neoplasia, those tumors like SCC and sarcoids, they can definitely affect the third eyelid too. Need biopsy and treatment just like on the other lids.
Okay.
And here's something important. Just seeing a prominent third eyelid, where it's sitting further across the eye than usual, that's often a nonspecific sign. It can mean there's eye pain somewhere, or it could even signal a systemic problem, like tetanus, dehydration, or severe weight loss. It's a clue that something else needs investigation.
So it's not always a problem with the third eyelid itself.
Exactly. It's
Okay.
often a sign for the third eyelid about something else going on. Treating the underlying cause is key.
This has been such a thorough walkthrough,
Yeah.
really deep dive stuff. So for our listener thinking about everything we've covered, what are the big picture takeaways? What should they really hold on to from all this specialized information?
Yeah, if we zoom out, connected to the bigger picture, there are definitely some key takeaways. First, that thorough, systematic ophthalmic exam. It's fundamental for all eyelid issues. Can't skimp on it, and you heard it plenty. Never skip the fluorescein stain.
Right, rule number one.
Second, knowing the anatomy precisely. It's essential for successful surgery, especially on lacerations, to prevent those long-term problems like notching that can harm the cornea. Third, eyelid masses always need a biopsy for a definitive diagnosis. Treatment varies so much by tumor type, and those common ones, SCC and sarcoids, they need specific, often aggressive approaches.
Biopsy is non-negotiable for lumps.
Absolutely. What's also fascinating, I think, is how simple prevention can help. Things like fly masks, UV blocking masks, especially for those pale-skinned horses, can genuinely reduce the risk of SCC. Keeping stalls clean, reducing dust, that helps minimize allergic or irritant eyelid swelling.
Simple things can make a difference.
They really can.
Mm.
Also, the prognosis. For many eyelid problems, if caught early and treated right, the prognosis is excellent. But it can definitely become guarded or poor with severe trauma, big tumors, or if treatment gets delayed. Early intervention matters. And finally, always keep in mind that eyelid signs might just be the tip of the iceberg. They could be linked to other eye surface problems or problems inside the eye, or even systemic disease. And conversely, chronic eyelid problems like scarring or poor function after injury can lead to serious corneal disease and vision loss if not managed properly. It's all connected.
What a journey through the equine eyelid. I mean, from tiny glands stopping tears evaporating to these really complex surgical repairs saving site. We've really seen how critical these structures are. You now have essentially a specialist perspective on recognizing, diagnosing, treating these conditions, a real shortcut to being well informed.
It really does underscore that delicate balance, doesn't it? Anatomy, function in every living thing. This deep dive, it highlights how critical even seemingly small parts are to overall health and, how vigilant we need to be.
So, what does this all mean for you listening? Maybe next time you look at a horse, you'll see more than just a beautiful animal. You'll appreciate that intricate protective design around their eyes, the subtle signals they might be giving off. And this raises an important question, maybe something for you to think about. Given the amazing resilience, that incredible healing power of eyelid tissue we talked about, what other seemingly small, maybe insignificant parts of the body in any creature might be silently performing these vital, life-sustaining roles that we just tend to take for granted? Keep exploring, keep learning, and we'll see you on the next deep dive.